You are lying on the floor of a cave and your leg is wrong. Not sprained. Not bruised. Wrong. The bone below your knee has been shattered, or the flesh has gone dark and rotten from a wound that will not heal, and everyone gathered around you in the flickering firelight knows what has to happen next. There is no hospital. No painkiller. No sterile blade. There is only a sharpened stone, a circle of people who love you, and a decision that will either save your life or end it in a spray of blood on the cave floor. This is not a horror story. This is medicine. And it happened for real tens of thousands of years before anyone built a single hospital. For most of your life, you have probably assumed that surgery is a modern miracle. Anesthesia, antiseptic, steady hands in a bright, clean room. You assume that before all of that, an injury was simply a death sentence. You broke a leg, you got an infection, you died. That's the story we tell ourselves about the deep past. Brutal, short, hopeless. But the bones tell a different story. A stranger, more astonishing story. Because your ancestors were cutting into human bodies, removing limbs, drilling into skulls, and keeping people alive afterward at a time so far back it makes the pyramids look like they were built yesterday. When the Borneo surgery happened, the last ice age was still gripping the planet. Mammoths still walked the earth, and farming would not be invented for another 20,000 years. And the more archaeologists dig, the further back that story keeps getting pushed. So, how did prehistoric humans perform surgery? Real surgery with nothing but stone tools and firelight? And what does it reveal about who your ancestors actually were? To understand that, you have to throw out almost everything you assume about cavemen. Because they were not the grunting brutes of cartoons, they were something far more surprising. Let's start with the discovery that rewrote the entire history of medicine, and it comes from a cave in the jungles of Borneo. In 2020, a team of archaeologists led by Tim Maloney from Griffith University in Australia was excavating a remote limestone cave called Liang Tebo in the Indonesian part of Borneo. It's a place so isolated you can only reach it by boat at certain times of year, surrounded by steep mountains and some of the oldest cave paintings on Earth. And buried in the floor of that cave, they found a skeleton, a young adult carefully laid to rest. But something about the left leg stopped them cold. The lower left leg was gone. Not broken off, not chewed by an animal, not snapped in an accident. The bones of the shin, the tibia, and fibula ended in a clean, healed stump cut through at a deliberate angle a few inches above where the ankle used to be. Someone had removed this person's foot and lower leg. On purpose. Surgically. And here's the part that stops your breath. The bone had healed. It had grown back over the cut, smooth and remodeled, which means this person did not die on the operating table. They lived. The researchers, including the bioarchaeologist Melandri Vlok, determined that this individual survived the amputation for another 6 to 9 years after the surgery. And the surgery itself happened at least 31,000 years ago. Sit with that number. 31,000 years. This was not a farmer. This was not someone from a city with doctors and knowledge passed down in books. This was a hunter-gatherer deep in the Ice Age, living in a jungle whose community took a stone blade, cut through skin, muscle, blood vessels, and nerves, removed part of a leg, stopped the bleeding, prevented infection, and nursed that person back to health over years. Before this discovery, scientists genuinely believed complex surgery like this was impossible until humans settled into farming villages around 10,000 years ago. This single skeleton pushed the timeline back more than 20,000 years in one stroke. But here's the question that discovery forces you to ask. If they could do that, how do you amputate a limb with a rock and not kill the patient? Because that turns out to be almost unbelievably hard. And to understand why, you have to understand what surgery is actually fighting against. There are 3 ways an amputation kills you, and each one is a monster in its own right. The first is blood loss. Your leg is fed by major blood vessels, and if you simply hack through them, a person can bleed to death in minutes. The second is shock, the body's catastrophic reaction to massive trauma and pain, which can stop the heart on its own. And the third, the slowest and cruelest, is infection. An open wound in a dirty world is an open door for bacteria, and before antibiotics, a wound infection could rot a person alive over days or weeks. Modern surgeons defeat these 3 monsters with clamps, sterile tools, and antibiotics. So, how did someone in a Borneo cave defeat them 31,000 years ago? The honest answer is that we don't know every detail, but the evidence in the bone tells us they must have known things. They had to have understood how to cut in the right place high enough above the rot but leaving enough limb to heal. They had to have known how to control the bleeding, perhaps with pressure, perhaps with heat, perhaps with plant compounds. And crucially, they had to have kept that wound clean enough in a hot tropical jungle swarming with microbes for it to heal without lethal infection. That is not luck. That is knowledge. Hard-won, passed-down sophisticated medical knowledge in a people we were taught to think of as primitive. Consider just how much anatomical understanding this required. To amputate a lower leg successfully, you cannot simply saw straight through. You have to know that if you cut too low through the crushed or infected tissue, the rot will spread and kill your patient. You have to know to go higher into healthy flesh. You have to navigate around the major blood vessels controlling them so the patient does not bleed out while cutting through the muscle and severing the bone cleanly. You have to leave a flap of skin and tissue to fold over the stump so it can close and heal. This is a mental map of the human body's interior, held in the mind of someone who had never seen an anatomy textbook, who learned it from watching, from doing, from the accumulated wisdom of a people who had clearly done this before. The clean angled cut on that Borneo skeleton was not a desperate hack. It was a technique. And amputation was only one weapon in the prehistoric surgical kit. Because there is another operation, even stranger, even more terrifying, that shows up again and again across the ancient world. And it targets the most sacred, most protected part of the entire human body, the head. The procedure is called trepanation, and it is exactly as alarming as it sounds. Trepanation is the practice of cutting, scraping, or drilling a hole directly into a living person's skull. Not after death, while they were alive, and it is, as far as we know, the oldest documented surgical operation in all of human history, showing up as far back as the Mesolithic and becoming genuinely widespread in the Neolithic period. Picture what this required. You take a person conscious or barely sedated and you begin to scrape away at the bone of their skull with a sharpened piece of flint or obsidian. You scrape and scrape layer by layer, knowing that if you push too far, too fast, you will plunge into the brain and kill them instantly. You have to remove a disc of solid bone while stopping at the delicate membrane just above the brain itself. With a rock? By hand. On a screaming, living human being. And here is the detail that will genuinely stun you. They survived. Constantly. When archaeologists examine trepanned skulls, they look at the edges of the hole. And in a huge number of cases, the edges are smooth, rounded, and regrown, covered in new bone tissue. That healing, that regrowth of bone, can only happen in a living person over months or years. It is undeniable proof that the patient walked away from having a hole cut in their skull and lived sometimes for decades. Across Neolithic sites in Europe, in places like France and the Czech Republic, archaeologists estimate that somewhere between 5 and 10% of all recovered skulls show evidence of trepanation. 5 to 10%. This was not a freak occurrence. It was a common, established medical practice. And some skulls show something even more astonishing, multiple holes from multiple separate operations all healed. Meaning the same person underwent this terrifying surgery more than once and survived every single time. They came back for a second operation, which tells you they must have believed the first one helped. Think about the trust that requires to lie back down and let someone open your skull again because it worked well enough the first time that you were willing to risk it once more. That is not the behavior of a terrified victim of superstition. That is the behavior of a patient who believed from experience that their healer knew what they were doing, which raises the haunting question. Why? Why would anyone drill a hole in a human skull in the first place? What could possibly be worth that risk? The answers reveal how deeply your ancestors thought about the body and the mind. In some cases, trepanation appears to have been genuine medical treatment. A blow to the head, common in a violent, dangerous world, can cause the brain to swell or bleed inside the skull, and that pressure is deadly. Opening a hole in the skull relieves that pressure, and remarkably, this is a principle modern neurosurgeons still use today when they perform a procedure to relieve swelling in the brain. Your ancestors may have figured out through observation and horrifying trial and error that releasing that pressure could save a life. They stumbled onto real neuroscience with stone tools. But in other cases, the reason was almost certainly about the invisible world. Many prehistoric and ancient cultures believed that illnesses like seizures, chronic headaches, or mental disturbances were caused by evil spirits or demons trapped inside the head. And a hole in the skull was in their understanding a door, a way to let the bad spirit out. To us, this sounds like superstition, but look closer at what it reveals. These were people trying to understand the mind, trying to locate the source of suffering inside the head, and taking dramatic action to heal it. It's a flawed theory, built on a profound and correct instinct that something inside the skull governs who we are. And they were willing to risk everything to fix it. So we have hunter-gatherers amputating limbs and drilling skulls. But this still leaves the biggest mystery of all. Not the how of the cutting, but the how of the surviving. Because cutting is the easy part. Keeping someone alive afterward in a world crawling with infection and without a single modern medicine, that is the true miracle. And the answer lies in a pharmacy that was growing all around them. Your ancestors were surrounded by a living medicine cabinet, and they knew how to use it. Across the world, traditional and prehistoric peoples developed a staggering knowledge of the medicinal properties of plants. And this is not guesswork. We have direct physical evidence buried in the mouths of the dead. Consider the Neanderthals, our close cousins long dismissed as the dumbest of all ancient humans. At a site called El Sidrón in Spain, researchers analyzed the hardened plaque, the calcified gunk on the teeth of Neanderthal individuals. Trapped in that plaque, they found microscopic traces of what these individuals had been putting in their mouths. And one of them, an individual with a painful dental abscess and an intestinal parasite, had been consuming two very specific things. Poplar, a plant that contains salicylic acid and the natural active ingredient in aspirin, and traces of a type of mold that produces penicillin, a natural painkiller and a natural antibiotic, being used by a sick Neanderthal tens of thousands of years ago, apparently to treat his own ailments. Let that reframe everything. A creature we called a brute was self-medicating with the ancient ancestors of the two most important drugs in your modern medicine cabinet, the painkiller and the antibiotic. This is the knowledge that made surgery survivable. If you understand that certain barks dull pain, that certain molds and plants fight the rot of infection, that certain leaves can be packed onto a wound, then suddenly amputation and trepanation stop being suicidal gambles and start being risky but real medicine. And the plant pharmacy went far deeper than aspirin and penicillin. Across the world, traditional healers independently discovered an astonishing toolkit. Yarrow, a common flowering plant, contains compounds that help blood clot and reduce bleeding, and it has been used to pack wounds for thousands of years. In fact, traces of yarrow have been found in that same Neanderthal dental plaque, and the plant is bitter with almost no nutritional value, which strongly suggests it was being eaten as medicine, not food. Honey, one of the oldest wound dressings known to humanity, is naturally antibacterial. It draws water out of bacteria and slowly releases hydrogen peroxide, and it was smeared onto wounds in ancient Egypt and countless other cultures because quite simply it worked. Certain tree resins and saps have antiseptic properties. Maggots, revolting as it sounds, were used to clean dead tissue from wounds while leaving the living flesh untouched, a technique so effective that modern hospitals occasionally still use sterile maggots today. Now imagine combining all of this. A healer who cuts cleanly, who packs the wound with a blood-clotting plant, who dresses it in antibacterial honey, who gives the patient willow bark or poplar to dull the pain, and who keeps the wound covered and clean. Suddenly, the survival of that Borneo amputee stops looking like a miracle and starts looking like the predictable result of deep accumulated expert knowledge. These healers had assembled through thousands of years of observation, a functioning system of surgical medicine without ever writing down a single word of it. And this points to the deepest truth of prehistoric surgery, the thing that ties the whole story together. It was never really about the tools. It was about the knowledge and even more about the care. Here's what we mean by that, and it's where the science of the body meets the science of the mind. Think again about that young amputee in Borneo who lived 6 to 9 years after losing a leg. In a hunter-gatherer world where survival depended on the ability to walk, run, hunt, and gather across brutal terrain, a person with one leg was in cold survival terms, a burden. They could not keep up. They could not forage effectively. They needed help getting food, moving camp, staying clean, and healing not just for the days after surgery, but for years. And their community provided it. For years. This tells us something that no stone tool ever could. It tells us that these people valued a single human life enough to pour enormous resources into saving it with no guarantee of return. This is what anthropologists studying Neanderthal remains like the researcher Penny Spikins have called prehistoric healthcare. When you find a skeleton of an individual whose who survived for years with devastating injuries, a withered arm, a blindness, a crippling disability. You are not just looking at one tough survivor. You are looking at the invisible evidence of a whole community that chose day after day to keep that person alive. The most famous example is a Neanderthal man from Shanidar cave in Iraq, sometimes called Shanidar I. When his skeleton was studied, it revealed a catalog of catastrophic injuries. He had a withered, likely useless right arm that had possibly been amputated below the elbow. He had suffered a massive blow to the head that probably left him blind in one eye. He had damage to his leg that would have made him limp badly. And every one of these devastating injuries had healed long before he died. This man with one arm half blind and lame lived to what was for a Neanderthal an old age. He could not have done it alone. He survived because others hunted for him, protected him, and cared for him for years, maybe decades. Compassion, it turns out, is at least as old as our cousins, the Neanderthals, and probably far older still. And this is the astonishing reframe that the bones force upon us. We tend to define the dawn of humanity by our weapons, our tools, our capacity for violence and dominance. But the archaeological record of prehistoric surgery tells the opposite story. The thing that truly set your ancestors apart was not just the ability to kill, but the ability and the fierce collective will to heal. To look at a broken member of the tribe and decide together this person is worth saving. This person is one of us. But why? Why would evolution produce a creature that pours precious resources into saving a member who, in pure survival terms, has become a liability? To understand that, you have to look at two things at once: what is happening in the body and what is happening in the mind. Start with the body because the biology is genuinely dramatic. When you are cut, your body launches an emergency response of staggering sophistication. Within seconds, tiny cell fragments called platelets rush to the wound and begin to clump together, forming a plug. A cascade of proteins then weaves a mesh of fibrin, a kind of biological net that traps blood cells and hardens into a clot, sealing the breach. This is why a prehistoric patient did not necessarily bleed to death. Their own body was fighting to close the wound, and a skilled healer only had to help it along with pressure and the right plants. Then the immune system floods the area with white blood cells that hunt and devour invading bacteria. Your body is in effect running its own internal surgery and its own internal pharmacy every single time you are hurt. The prehistoric healer's job was to buy that system enough time and enough cleanliness to win. They were not working against the body. They were working with it as its assistant. Now the mind, because this is where the real answer lies. Humans are one of the most intensely cooperative species that has ever existed. And a growing body of research suggests that caring for the sick and injured was not a luxury our ancestors could barely afford. It was a core part of what made us successful. A group that abandoned its injured lost not just a person, but all the knowledge, all the relationships, and all the future contributions that person carried. A group that healed its injured kept its skilled hunters, its wise elevators, its storytellers, its parents alive and contributing. Over deep time, compassion was not weakness. It was strategy. The tribes that cared for each other were the tribes that survived, and they passed that instinct down to you. There is something even deeper here, a psychological truth about our species. Caring for a wounded person requires you to do something remarkable, to imagine their pain as if it were your own, and to act to relieve it. This is empathy, and it appears to be woven into the human brain at a fundamental level. When you see someone suffer, networks in your own brain light up as though you were suffering too. Your ancestors felt that pull, that unbearable urge to help a suffering member of the group, and they acted on it with stone tools and plant medicine and years of patient care. Surgery, in the end, is empathy made physical. It is what happens when the feeling of "I cannot stand to watch you suffer" is combined with the knowledge of how to do something about it. Now let's step even further back and marvel at the sheer scope of what these ancient healers achieved, because it did not stop at limbs and skulls. By around 5,300 years ago, humans in northern Spain were performing delicate ear surgery, cutting into the skull to relieve the agony of an ear infection. In ancient Egypt, we find evidence of medical sophistication that included one of the oldest known functional prosthetics, a beautifully crafted artificial toe made of wood and leather fitted to the foot of a woman roughly 3,000 years ago, and worn so well that it shows signs of real use. Someone lost a toe, and someone else built them a replacement so they could walk properly again. That is not just medicine. That is engineering empathy and craft braided together. The oldest confirmed amputation in Europe before Borneo rewrote the record was that 7,000-year-old farmer from Bouthiers-Boulancourt in France, whose left forearm had been carefully and skillfully removed above the elbow, and who then survived and healed. And it went even smaller and more delicate than limbs and skulls. Prehistoric humans were also dentists. At a 9,000-year-old site in Pakistan called Mehrgarh, archaeologists found human teeth with tiny, precise holes drilled into them, almost certainly to remove decay, and relieve the agony of a rotting tooth using a bow, drill-tipped with flint. Anyone who has ever had a toothache can appreciate the desperation and the courage behind letting someone drill into your living tooth with a stone. At another prehistoric site, researchers found a tooth cavity that had been filled with beeswax thousands of years ago, an ancient filling. These were not people numbly enduring their pain. They were actively fighting it, inventing tools and techniques to attack suffering wherever it appeared in the body, right down to a single aching tooth. Around the Yellow River in Neolithic China, trepanned skulls tell the same story of surgical daring. From the Inca in South America, who became so skilled at trepanation that their patient survival rates were extraordinarily high, higher by some estimates, than the survival rates of skull surgery in Europe during the American Civil War. Thousands of years later to ancient Greece, where the practice was written about by physicians, this operation appears again and again on nearly every inhabited continent, invented and reinvented by peoples who never met. The urge to open the body and fix what was broken is, it seems, one of the most deeply human urges there is. And here is the twist that should change how you see the entire ancient world. We call these people prehistoric, primitive Stone Age, as if those words mean simple or stupid. But a Stone Age surgeon who could amputate a leg without antibiotics and keep the patient alive for years was in the context of their own world performing at the absolute frontier of what was possible. They were doing something that Western medicine could not reliably do until barely 100 years ago. For most of the history of modern Europe, an amputation was a death sentence, more often than not killing patients through infection and blood loss at horrifying rates. And yet a hunter-gatherer in an Ice Age jungle managed it 31,000 years ago. The gap between how we imagine these people and who they actually were is one of the great injustices of how we tell the human story. They were not waiting around in the dark for civilization to arrive and teach them things. They were observing, experimenting, learning, and passing down knowledge across generations. They were scientists in every way that matters, running the slow, deadly patient experiment of trying to heal each other with the only tools they had. So think back to that person lying on the cave floor, leg-shattered circle of firelit faces around them, a sharpened stone catching the light. We started this as if it were a horror story. But look at it again now with everything you know. That circle of faces is not a mob. It is a medical team. That stone is not a weapon. It is a surgical instrument wielded by someone who has done this before, who learned it from someone, who learned it from someone else, reaching back through countless generations. Those plants being ground into a paste are not superstition. They are pharmacology. And that decision to operate to try to fight for one life against the darkness is the oldest and most human thing there is. Your ancestors were not simply surviving. They were caring for each other with a skill and a devotion that we are only now, thousands of years later, beginning to fully understand. They looked at suffering and did not turn away. They looked at a broken body and thought, we can fix this. We will not let you go. You come from healers. From people who cut into skulls to save a mind, who removed limbs to save a life, who built a wooden toe so a friend could walk, who fed and carried and protected their wounded for years without complaint. Every hospital, every surgery, every quiet act of care you will ever receive is the descendant of that firelit circle in the cave. The white coat is new. The impulse behind it is older than farming, older than writing, older than cities. It is one of the very first things that made us human. And it lives in you still. The instinct that makes you wince when you see someone hurt, that makes you rush toward a fallen stranger, that makes you sit up all night beside a sick child, that is not a modern refinement. It is the same ancient fire that burned in the healer bent over that shattered leg 30,000 years ago. You inherited it. You carry it. The next time you take an aspirin, or get a stitch, or walk into a hospital and trust that you will walk back out, remember where that impulse truly began. Not in a modern operating room, but on the floor of a cave in the firelight, in the trembling, determined hands of someone who loved you 30,000 years before you were ever born. The leg is wrong. The stone catches the light. And the people who love you decide together that you are going to live.